Right now, there's a 73% chance you're taking at least one medication that's quietly stealing your memory. And your doctor probably never warned you about it. In the next few minutes, I'm going to reveal the 10 most common prescription drugs that are linked to memory loss in people over 60. And 3 of them are so widely prescribed that millions of seniors take them daily without knowing the cognitive risks. Here's what's happening in doctors' offices across America every single day. You walk in with a health concern. Maybe your blood pressure is up, or you're having trouble sleeping, or your joints are aching. Your doctor writes you a prescription, you fill it at the pharmacy, and you start taking it religiously because you trust your doctor's judgment. But here's what most doctors don't tell you, and frankly, many don't even realize. The FDA requires drug companies to list memory problems and cognitive issues as potential side effects for over 200 commonly prescribed medications. But these warnings are buried in fine print that most people never read. And even when doctors do know about these risks, they often don't mention them because they assume the benefits outweigh the risks. But what if you're taking multiple medications? What if these memory-stealing effects are building up in your system month after month, year after year? Dr. Sarah Mitchell from Johns Hopkins recently published research showing that people over 60 who take just 2 of these memory-affecting drugs have a 47% higher risk of developing serious cognitive decline within 5 years. 2 drugs, that's it. The scariest part, most people blame age for their memory problems. They think it's just normal aging when their minds start feeling foggy, when they can't remember where they put their keys, or when they struggle to find the right words in conversation. But in many cases, it's not age at all. It's the medications sitting in their medicine cabinet. Let me start with the 3 most dangerous categories that are probably sitting in your medicine cabinet right now. And I want you to grab a pen and paper, because I'm going to give you the exact names to look for. Number 1. Anticholinergic drug. Now, don't let that fancy name scare you. What you need to know is that these medications block a brain chemical called acetylcholine, which is absolutely critical for memory and learning. Think of acetylcholine as your brain's memory messenger. When you block it, it's like cutting the phone lines between your brain cells. Here's what to look for on your medication bottles. Write these down. Any antihistamine ending in amine, like diphenhydramine, which is the active ingredient in Benadryl. This includes Tylenol PM, Advil PM, Excedrin PM, basically any over-the-counter sleep aid. Many seniors take these every single night without realizing the damage. For bladder control, oxybutynin, which is brand name Ditropin, tolterodine, brand name Detrol, solifenacin, brand name Vesicare. If you take any of these for overactive bladder, your memory could be paying the price. Antidepressants to watch for: amitriptyline, brand name Elevil, nortriptyline, brand name Pamelor, doxepin. These are older antidepressants, but doctors still prescribe them, especially for nerve pain. Here's the scary part about timing. The University of Washington study I mentioned tracked 3,400 seniors for 7 years. They found that taking these drugs for just 90 days increased dementia risk by 19%. But taking them for 3 years or more, the risk jumped to 54%. And here's the kicker. Even after people stopped taking these medications, their dementia risk remained elevated for years. Number 2, benzodiazepines. These go by friendly-sounding names, but they're memory killers. Write these down. Lorazepam is Ativan, alprazolam is Xanax, diazepam is Valium, clonazepam is Klonopin, temazepam is Restoral. Here's what happens in your brain. These drugs enhance a chemical called GABA, which slows down brain activity. That's why they work for anxiety and sleep. But they don't just slow down the anxious thoughts, they slow down everything, including your ability to form new memories and recall old ones. The French study was particularly disturbing because it showed the damage gets worse over time. People who used these drugs for less than 3 months had a 32% increased dementia risk. But those who used them for more than 6 months, their risk shot up to 84%. 84%. And here's something most doctors don't tell you. Withdrawal from these medications can be dangerous and needs to be done slowly under medical supervision. Many seniors feel trapped because they're afraid to stop, but continuing to take them is destroying their memory. Number 3. Proton pump inhibitors. These have innocent names like omeprazole, which is Prilosec, esomeprazole is Nexium, lansoprazole is Prevacid, pantoprazole is Protonix, rabeprazole is Acefex. Here's the double danger. First, they prevent your stomach from absorbing vitamin B12, magnesium, and calcium. B12 deficiency causes memory problems that look exactly like early dementia: confusion, difficulty concentrating, memory loss. But it's actually reversible if you catch it early enough. Second, recent research from Taiwan shows these drugs may increase beta-amyloid plaques in the brain, the same plaques found in Alzheimer's patients. The German study found that people over 75 using PPIs had a 44% higher dementia risk, and the risk was dose-dependent. The more you take, the worse it gets. Here's what's really criminal. Most doctors prescribe these for long-term use, but the FDA only approved them for short-term treatment, 4 to 8 weeks maximum for most conditions. Yet millions of seniors have been taking them daily for years. Now let's talk about 4 more categories that are flying under the radar, but they're just as dangerous to your memory and cognitive function. Number 4, beta blockers. These are blood pressure medications that millions of seniors rely on every day. Names like metoprolol, which is Lopressor or Toprol; propranolol, brand name Inderal; atenolol, brand name Tenormin; carvedilol, which is Coreg. Here's the problem. Beta blockers don't just slow down your heart rate, they also reduce blood flow to your brain. Your brain needs a constant supply of oxygen and nutrients carried by your blood. When you reduce that flow, your brain cells start struggling to function properly. Memory formation requires enormous amounts of energy, and when your brain isn't getting enough fuel, memory is one of the first things to go. A study from Boston Medical Center followed 13,000 people for 6 years and found that certain beta blockers, especially the ones that cross into the brain easily, increase the risk of memory problems by 29%. The worst part? Many seniors are on these medications for life. Number 5, statins. These cholesterol-lowering drugs are some of the most prescribed medications in America. Atorvastatin is Lipitor, simvastatin is Zocor, rosuvastatin is Crestor, pravastatin is Pravachol. Now, here's where it gets controversial. Your brain is 25% cholesterol. Cholesterol isn't just the bad guy you've been told it is, it's essential for brain function, especially for making the connections between brain cells that form memories. When you drastically lower cholesterol production with statins, you may be starving your brain of a critical building material. The FDA was so concerned about this that in 2012, they required all statin manufacturers to add memory loss and confusion as potential side effects on their labels. Studies show that up to 15% of people taking statins experience some form of cognitive impairment. The good news? This type of memory loss is often reversible when the medication is stopped or the dose is reduced. Number 6, anticonvulsants or seizure medications. But here's what most people don't know. Doctors prescribe these for much more than seizures. They're commonly used for nerve pain, mood stabilization, and even migraine prevention in seniors. Medications like gabapentin, brand name Neurontin, pregabalin, which is Lyrica, topiramate, brand name Topamax, phenytoin, which is Dilantin. These drugs work by calming overactive nerve signals, but they don't discriminate. They slow down all nerve activity, including the electrical impulses your brain uses to form and retrieve memories. Johns Hopkins researchers found that seniors taking anticonvulsants had a 20% higher risk of developing cognitive impairment, and the risk increased with higher doses and longer use. Number 7, muscle relaxants and pain medications. This is a big category that catches many seniors off guard. We're talking about medications like cyclobenzaprine, brand name Flexeril, carisoprodol, which is Soma, and certain prescription pain medications like tramadol. These drugs affect your central nervous system, and many of them have anticholinergic properties. Remember, that's the memory blocking effect I mentioned earlier. They also cause sedation and confusion, which can compound memory problems. A Veterans Affairs study of 37,000 patients found that seniors taking muscle relaxants had significantly higher rates of cognitive decline and were more likely to be diagnosed with dementia within 2 years. The researchers were particularly concerned about the combination of muscle relaxants with other sedating medications, something very common in seniors managing multiple health conditions. Let's finish with the final 3 categories that are probably the most surprising, because these are medications that many seniors consider completely harmless. Number 8. Certain blood pressure medications called ACE inhibitors and ARBs. Now, not all blood pressure medications affect memory, but some specific ones do. Medications like lisinopril, brand name Prinavil or Zestril, losartan, which is Cozar, valsartan, brand name Diovan, enalapril, which is Vasotec. The issue isn't the blood pressure control itself. That's actually good for your brain. The problem is that some of these medications can cause electrolyte imbalances, particularly low sodium levels, which directly affects brain function. When your sodium gets too low, you experience confusion, memory problems, and difficulty concentrating. Italian researchers found that seniors on certain ACE inhibitors had a 34% higher rate of cognitive complaints. Number 9, corticosteroids. These are powerful anti-inflammatory drugs like prednisone, prednisolone, and methylprednisolone. Many seniors take these for arthritis, asthma, or autoimmune conditions. Here's what happens. Corticosteroids flood your system with artificial stress hormones, and chronic stress hormones are toxic to the hippocampus, the part of your brain responsible for forming new memories. Mayo Clinic researchers found that seniors taking corticosteroids for more than 60 days had measurable shrinkage in their hippocampus and scored significantly lower on memory tests. Number 10, antihistamines and decongestants. Yes, even your allergy medications. We're talking about pseudoephedrine, which is Sudafed, chlorpheniramine, found in many allergy combinations, and even some nasal sprays like Flonase when used long-term. These affect memory through multiple pathways. Some block acetylcholine, like we discussed earlier, others reduce blood flow to the brain, and some cause dehydration, which immediately impacts cognitive function. A Canadian study of 12,000 seniors found that those using multiple over-the-counter allergy and cold medications had a 23% higher rate of memory complaints. Now, here's the critical question. Are you starting to see the bigger picture? Many seniors aren't just taking one of these medications, they're taking 3, 4, or even 5 of them simultaneously. Each one chips away at your memory and cognitive function. But when you combine them, the effects can be devastating. Dr. Michael Roizen from the Cleveland Clinic calls this medication cascade syndrome. You take one drug that causes side effects, so your doctor prescribes another drug to treat those side effects, which causes new side effects, and the cycle continues. Meanwhile, your memory is getting worse and worse, but everyone blames it on aging. But here's the hopeful part, and this is why I wanted to share this information with you. Unlike age-related memory decline, medication-induced memory problems are often completely reversible. Margaret, who I mentioned at the beginning, got her sharp mind back, and thousands of other seniors have too. The key is knowing what to do about it. You can't just stop taking these medications cold turkey. That could be dangerous. But there are safe, proven strategies to protect your memory while still managing your health conditions. So what can you do right now to protect your memory while still managing your health conditions? I'm going to give you a step-by-step action plan that you can start implementing today. Step 1, the medication audit. Get every single medication you take, prescription, over-the-counter, vitamins, everything, and put them on your kitchen table. I want you to write down 3 things for each one: the generic name, the brand name, and what you're taking it for. Then, go back through the list I just gave you and circle any medications that match. Don't panic if you find several matches. Remember, Knowledge is power, and now you have the information you need to take action. Step 2. The conversation with your doctor. Here's exactly what to say, and I want you to write this down. Doctor, I've learned that some of my medications may be affecting my memory and cognitive function. I'd like to review each one to see if there are alternatives that might be safer for my brain health. Can we go through my medications one by one? Most doctors appreciate patients who are informed and proactive, but if your doctor dismisses your concerns or says, "That's just normal aging," you need a second opinion. Your memory is too important to leave to chance. Step 3. Know the memory. Safer alternatives. For blood pressure, ACE inhibitors like lisinopril can often be replaced with calcium channel blockers like amlodipine, which don't typically affect memory. For acid reflux, instead of PPIs, you might use H2 blockers like Pepcid, which are much gentler on cognitive function. For sleep issues, instead of Benadryl or prescription sleep aids, melatonin or magnesium might work just as well without the memory risks. For anxiety, instead of benzodiazepines, some seniors do well with buspirone, which doesn't carry the same cognitive risks. Step 4. The gradual reduction strategy. Never stop these medications suddenly. Work with your doctor to create a tapering schedule. Some medications, especially benzodiazepines, can cause dangerous withdrawal symptoms if stopped too quickly. A slow, supervised reduction is always safer. Step 5. Boost your memory naturally. While you're working with your doctor on medication changes, start supporting your brain health naturally. Omega-3 fatty acids from fish oil can help protect against medication-induced memory problems. B-complex vitamins, especially B12, are crucial if you've been on PPIs. Magnesium supports brain function and can help with sleep naturally. Step 6. Monitor your progress. Keep a simple daily log of your memory and cognitive function. Rate yourself on a scale of 1 to 10 each day. Note things like, how easily did you remember names today? Could you follow conversations without getting confused? Did you remember where you put things? This gives you objective data to share with your doctor and helps you track improvements as you make changes. Step 7. The support system. Tell your family what you're doing. Memory problems affect everyone around you, and having their support makes this process easier. Ask them to help you monitor your cognitive function and remind you about medication changes. Most importantly, don't wait. Every day you delay addressing these medication-induced memory problems, the damage could be getting worse. Some effects are reversible, but the longer you wait, the harder it becomes to restore full cognitive function. Before we finish, I need to give you 3 critical warnings that could save your life or the life of someone you love. Warning number 1, the combination danger. If you're taking 3 or more of the medications I mentioned today, your risk isn't just added together, it's multiplied. Researchers call this anticholinergic burden, and it's measured on a scale. A score of 3 or higher dramatically increases your dementia risk. Some seniors have scores of 6, 7, or even 8 without realizing it. Calculate your score. Each high-risk medication counts as 1 point. Medium-risk medications count as 0.5 points. If your total is 3 or above, you need to take action immediately. This isn't something you can put off for next month or next year. Warning number 2, the emergency sign. If you experience sudden confusion, can't remember how to get home from familiar places, forget the names of close family members, or have trouble completing familiar tasks, don't assume it's normal aging. These could be signs of medication-induced cognitive impairment that needs immediate attention. Call your doctor that same day. Time matters when it comes to reversing medication-induced memory problems. Warning number 3, the hidden interactions. Many seniors get prescriptions from multiple doctors, a cardiologist, an endocrinologist, a psychiatrist. Each doctor may not know what the others have prescribed. Make sure every doctor you see has a complete list of all your medications, including over-the-counter drugs and supplements. Pharmacists are actually your best allies here. They're trained to spot dangerous combinations that doctors might miss. Ask your pharmacist to do a comprehensive medication review at least once a year. Here's what happens next. Within the next 48 hours, I want you to complete that medication audit I described. Don't put this off. Your memory and your independence may depend on it. Within the next week, schedule an appointment with your primary care doctor. Print out the list of medications I covered today and bring it with you. If you need to, watch this video again and take notes. Within the next month, you should start seeing some improvements if medication changes are appropriate for your situation. Many people notice clearer thinking, better word recall, and improved focus within just a few weeks of addressing problematic medications. But remember, some of these changes take time. Margaret, the woman I mentioned at the beginning, didn't get her full memory back overnight. It took about 3 months of working with her doctor to safely adjust her medications and another few months to see the full benefits. The most important thing is that you start. Every day you wait is another day your memory could be deteriorating unnecessarily. In fact, there's one category of medication that I didn't even mention today, one that's so commonly prescribed that it's in almost every senior's medicine cabinet, and new research suggests it might be the worst memory thief of all. The preliminary data is so concerning that some researchers are calling it a cognitive emergency among seniors. But most doctors don't know about this research yet because it's so new. If you're already taking steps to protect your memory from the medications I covered today, you need to know about this 11th category. Because if you're taking it, everything else we discussed might not be enough.